The Art of Administration and Management. It was a bright Monday morning at Sunrise Hospital, a beacon of hope and healing in the heart of Ghana. Today was special. It was a day when the newly appointed hospital administrator, Mr. Kweku, would step into his role, learn the ropes, and embrace the core values that drives this institution. His journey would reveal the intricate world of hospital administration and management, where every decision and every action has a direct impact on saving lives. The heartbeat of hospital management. As Kweku walked through the hospital corridors, he recalled the guiding principle he learned during his training. Management is the use of people and resources to accomplish objectives, creating a conducive environment for excellence. He remembered the words of his mentor, Dr. Ajimai, the hospital's medical superintendent. Good administration is good management. It's not just about organizing files or managing budgets. It's about ensuring that every decision we make saves a life and prevents legal complications. Our hospital is the final house of every healthy person who walks through our doors. This philosophy resonated with Kweku. He knew that hospital management wasn't just about policies or procedures, it was about saving lives and meeting the expectations of patients, staffs, and the community. Roles, expectations, and the triple helix of administration. During his morning briefing with the hospital board, Kweku met two key figures: Miss Efia, head of nursing who oversaw patient care and staff welfare, Mr. Kwesi, head of general administration, responsible for human resource, finance, and overall logistics. Together with Dr. Ajimai, they explained the key roles of hospitals. 1. Efficient delivery of care. From preventive and promotive services to curative and rehabilitative treatment, the hospital must address the entire spectrum of healthcare. Training and research. Number 2. The hospital is a hub for training health professionals and conducting clinical research. 3. Ensuring public trust. By maintaining high standards in licensure, accreditation, and customer care, the hospital justifies public investment and meets community expectations. Ms. Efia emphasized, our work is about more than just treatment. We create a healing environment that nurtures both patients and staff. Mr. Kwesi added, transparency in administration and effective management of resources are what keep us operating effectively every day. The structure, a symphony of three pillars. Kweku then toured the administrative offices where he discovered the tripartite system of administration that it formed the backbone of public hospitals in Ghana. The system, as outlined in Act 525 Amendment Act 2019, is divided into three essential components. 1. Medical services, led by medical officers who make clinical decisions. 2. Nursing administration, headed by nursing leaders who ensure patient care and staff well being. 3. General administration, managed by professionals handling finance, human resource, procurement, and overall logistics. Dr. Ajiman explained, in some cases, like faith based hospitals, non medical professionals may also lead our administration. But here at Sunrise, our collective leadership ensures that every unit from clinical services to general administration works in harmony. This integrated structure was essential for coordinating the complex activities within the hospital from day to day operations to long term strategic planning. Embracing reform and innovation. The hospital had recently undergone significant reforms in management, inspired by the broader health sector reforms in Ghana. A new institutional care division, ICD, had been established to develop clinical care policy guidelines and protocols, monitor and evaluate clinical care and ensure quality assurance, contribute to medium and long term strategic plans. Kweku attended a meeting where the ICD team presented their recent initiatives. One of the team leaders highlighted these reforms are about creating systems that support efficient management and quality clinical care. It's about adapting to trends and embracing technology. For example, our new electronic systems for monitoring clinical data and managing resources. He noted that these initiatives reflect current trends in hospital administration globally. Highly qualified technical professionals, staff continuously trained and updated through continuous professional development (CPD), patient rights and medical legal awareness. Rising costs, consumer consciousness requires us to be meticulous and legally compliant. Collaborative governance through regular board meetings, interdepartmental briefings, and community debates. We ensure that every stakeholder's voice is heard. Core values and special skills. During his orientation, Kweku was introduced to the hospital's core values: people centered, focusing on client centered care, valuing staff and building strong partnerships, professionalism, striving for the highest standards in service and encouraging personal and professional growth, teamwork, believing that collaborative effort, where together everyone achieves more, is key to overcoming challenges, innovation and excellence, continuously seeking new ways to improve and foster a learning environment, discipline and integrity, upholding accountability and ethical behavior in every action. To embody these values, hospital managers like Kweku need a special set of skills: leadership, delegation, and motivation, inspiring teams and ensuring everyone performs to their best, communication and public speaking, keeping lines open with staff and stakeholders, financial acumen, and quality assurance, managing resources wisely and ensuring that expenditures yield maximum benefit. Medical legal knowledge, navigating legal and regulatory frameworks like the Financial Management Regulation, Procurement Act, and the Patients Charter. Kweku reflected on these points as he viewed a checklist prepared by Mr. Kwesi, detailing the benchmarks for effective management, transparency, inclusiveness, capacity for diversity management, and a culture of accountability. Legal framework and economic rules of hospitals. In a session with a legal team, Kweku learned about the legal and regulatory documents essential for managing hospitals. Key documents included Financial Management Regulation (FAR), Procurement Act, Internal Audit Act, National Health Insurance Act, Patients Charter Act, Labor Law, HEFRA guidelines. These frameworks ensure that the hospital is not only meet its clinical objectives but also functions as a sustainable economic entity, responsibly managing the resources entrusted to it as outlined in the Ghana Health Service and THS Teaching Hospitals Act 1996, Act 525 as amended by Act 1009. The journey continues, teamwork and mutual trust. As the day drew to a close, Kweku gathered with his colleagues for a final debriefing. Reflecting on all he had learned, he realized that hospital management is a team effort, one that demands mutual trust, shared responsibility, and an unwavering commitment. Dr. Ajamine summarized at Sunrise Hospital, every decision we make, every meeting we hold, and every policy we implement is geared towards one goal: providing quality care and ensuring that our hospital remains a safe, efficient, and compassionate environment. We are not just administrators, we are custodians of hope and health. Kweku, now filled with renewed determination, knew that his role was not just a job, it was a calling to lead with integrity, foster teamwork, and continuously innovate for a betterment of everyone who depended on the hospital. A legacy of excellence. As night fell over Sunrise Hospital, the lights in the administration offices burned bright, a symbol of the relentless pursuit of excellence in hospital management. Kweku's journey had only just begun, but he was confident that with the right skills, core values, and a dedicated team, the future of hospital administration in Ghana was in capable hands. Thank you.